Clearly, on a societal or policy level, there's great change in the demographics and the aging of the population. There's a technological change, the electronic medical record or health record in particular. The expectations of physicians, both the ones coming out of training and some of the ones that have been in the field for longer, are changing. Physicians nowadays, with very good reason, they want a safe and secure kind of earning stream, and they want to be paid well, as we all do, but they're not willing to sacrifice their quality of life in return for that. So working with physicians, one, it drives them towards employment. It's rare to find the individual entrepreneur, the physician who wants to make it on his or her own. They really seek out an employment model. So that means a change, that means working in larger institutions by and large. So therein lies a much stronger kind of hospital-physician relationship. Earnings and quality of life from the individual physician's point of view, but part of what drives them to an institutional, a large health system model, for example, is that it's so doggone complicated, the practice of medicine these days. You almost can't be in the business anymore without an electronic medical record. The way I look at it is, it kind of has to do with a franchise concept. In return for that kind of advantage, you give up a lot of autonomy. And that's really what affects physicians these days. They'd like to have the good earnings and the sort of security and resources of a large organization, but they're loath to give up their autonomy. But more and more, I think the balance is kind of leaning toward they're willing to do that, assuming that certain levels of autonomy still remain sacrosanct.